Hi BDS1, this is Dr. Jason Brown and this is the 9th and penultimate lecture in my series, and today's lecture is entitled Healing and Repair. Here's the contents for today's lecture. The first thing I want to mention is today will only be one part of a lecture. It should be about 25 to 30 minutes in length. So just to be clear, there will not be a part A and a part B for this lecture. There'll only be the one recording. Okay, so in today's lecture, what we're going to talk about is regeneration and repair. And this lecture and the contents of this lecture should fit in nicely with the previous two sessions that I gave you. The one that's on acute inflammation and the one that's on chronic inflammation. So today what we're going to talk about specifically is healing of soft tissues and to a lesser extent healing of hard tissues. So when we talk about healing and regeneration and repair, there's four stages that arise within the immune system during this process. So we have the clotting phase and the inflammation phase. So these are two phases that we've talked about in great detail in previous lectures. We have the proliferation phase. So basically this involves each of these components. So the formation of granulation tissue, the process of angiogenesis, the importance of growth factors, and also this process of fibrosis. And we'll talk about each of these in a lot greater detail in today's session. And then finally, you have the maturation phase. We'll also touch upon this idea of primary versus secondary intentions. And this is basically just a fancy term that is used for whether your tissue undergoes the process of regeneration or whether your tissue undergoes the process of regeneration and then repair. And that is very much dependent on the severity of the injury or the severity of the infection in certain cases. And then in the last few slides of today's session, we'll talk about healing of hard tissues and we'll provide the fractures of bones as an example. And hopefully you'll learn a lot more about this process in other sessions from other lecturers, but we'll touch upon it today. So firstly, what is this idea of regeneration versus repair? Well, generally speaking, the restoration of tissues, which can also be known as the regeneration of tissues, arises in the process of acute inflammation. So this is something that we covered in the 7th session. This idea that as long as the tissue damage is minimal, then you will get complete restoration or complete regeneration of the tissues. In chronic inflammation, on the other hand, this is associated with greater tissue destruction, and in the vast majority of cases of chronic inflammatory diseases, you will need some level of repair of the tissue. And this diagram is what you've seen a few times before, and healing by repair quite nicely sort of brings together the principles that we've talked about with acute and also chronic inflammation. So it kind of ties up the last two lectures quite nicely. So to be a bit more specific, we have regeneration of tissues and repair of tissues. So terminology-wise, regeneration or resolution of tissue is where the infected or the damaged tissue is replaced with functional and differentiated cells. Repair of the tissue is, generally speaking, where you have production of a fibrous scar. So there's some level of scar formation within the previously infected or damaged tissue. And ultimately what you get is a tissue structure, an architecture of the tissue, which is slightly different to what the tissue looked like before the infection or the damage. And this process of regeneration and repair, in a very similar manner to acute versus chronic inflammation, it very much depends on the severity and the location of the damage. And in some cases, in some tissues, for example, some tissues have better regenerative capacities than others. So for example, in some tissues, such as, let's say, the heart or the brain, the tissue can't regenerate if damaged. Whereas in other tissues, such as epithelial tissue, then you will always get a constant regeneration of the tissue, a turnover of the cells that are present within that tissue. And the final thing to consider is that the genetic background of an individual will also dictate how effective their regeneration or repair of a certain infection or damage is. So there are certain defects that patients can have in their healing capacity. And again, this comes back to the idea of the surgical sieve, which we touched upon in the very first session, and this idea that you need to be aware of the systemic health of your patients. And this can, of course, dictate how well they can maybe respond to a certain dental related treatment. So just to go into a bit more detail, you have 3 different cell types that are involved in regeneration and repair. So these can be your liable cells, your stable cells, or your permanent cells. So the first type of cells are your liable cells. So these cells are in their normal state, are undergoing active cell division. Okay. These cells have the ability to provide rapid regeneration of a given tissue. So some good examples of liable cells are your epithelial cells or even your stem cells. So basically all of your immune cells that come from a stem cell lineage from the bone marrow have the potential to regenerate themselves. And within the context of the oral cavity, you have your oral keratinocytes. So these are basically the cells that are in the periphery of the tissue of, let's say, the gingival epithelium. So there's a constant turnover of these cells within the tissue, and thereby, if there is damage to that tissue, these cells can quite rapidly regenerate and repair the tissue. Your second cell type are your stable cells. So there's a variable rate of regeneration within these cells, but these cells have the ability to rapidly proliferate in response to injury. So good examples for these cells would be your liver cells or your kidney cells, or within the context of the oral cavity would be your oral fibroblasts. So the main difference between these cells and the liable cells are these cells will not constantly regenerate themselves unless they need to. Okay, so in certain cases when the tissue damage is maybe excessive within the oral cavity, or if we're talking about the liver and the heart, if there's damage to these organs, then these cells have the capacity to regenerate themselves following stimulation. And then finally, we have permanent cells. So as you can tell from the name, these are unable to divide, unable to regenerate. And good examples of these would be your heart or your muscle cells, or also your nerve fibers as well. So if we move on to talk about the 4 stages of healing, these are the first 2 stages. So you have the coagulation phase and the inflammation phase. These are things that we've talked about in great detail in previous sessions. So the coagulation phase is what we talked about in, I think, the acute inflammatory lecture, acute inflammation lecture. The inflammation phase is things that we've covered constantly throughout my sessions, where basically coagulation phase involves the formation of a blood clot, whereas the inflammation phase involves all of the different types of innate immune cells, particularly within the immune system. You have the proliferation phase, or the the proliferation phase, which involves things like fibroblasts that are important in basically remodeling and restructuring the tissue. And we'll talk about this in great detail because there's different mechanisms involved within this phase. And then finally, the maturation phase, which will basically be a process of continuing this tissue remodeling, which will lead to resolution in certain diseases. So these are the 4 stages. So these are the first 2. As I've said, the coagulation phase is basically the formation of a blood clot. This is something that we covered in lecture 7. This will involve your liable or your stable cells, such as your epithelial cells as well. The inflammation phase is where your immune cells, and particularly your innate immune cells, such as macrophages and neutrophils, that are important in phagocytosing and degrading the infectious agent or any damaged cells. And then finally, you also have other cells that play an important role in this phase, things like your fibroblasts, which will start to regenerate and repair the tissue, basically producing this collagen, which is found in the extracellular matrix underlying the tissue. But we'll talk about that in the next phase in a bit more detail. So this is the proliferation phase, and it's kind of split into 5 sections, and we'll talk about each of the individual sections in the next few slides. So firstly, you have formation of the granulation tissue. So this is an image now here showing what is known as granulation tissue. So this is in the oral cavity, this is on the skin. So what I need to just emphasize here is do not mistake granulation tissue for the granulomas that we talked about in the last session. The granulomas will form in certain diseases such as OFG, whereas granulation tissue will occur in all tissues following the process of repair and regeneration, or during the process of repair and regeneration. Fibroblasts that are important in this process, and they'll produce the new connective tissue via the production of collagen. Angiogenesis is the formation of new blood vessels, so we touched upon this briefly in the last session. And then finally, we'll talk about the growth factors and the important role that growth factors play in this whole process of repair and regeneration, particularly within this phase. So firstly, to talk about granulation tissue, there's ultimately 2 phases within the formation of this tissue. So the first phase is your vascular granulation tissue, and your second phase is your fibrous granulation tissue. So the first phase, the tissue is highly vasculated, and this allows for a flow of immune cells and plasma proteins to ultimately rebuild the structure of the tissue. The second phase, this consists of the fibrous tissue. So this is where you've got mature fibroblasts that are basically piecing together the tissue with or via the production of collagen. If we move on to talk about angiogenesis, this, as you should know by now, is the formation of new capillaries, or basically the formation of new blood vessels. So this process can arise from 2 mechanisms, and the 2 mechanisms are either called sprouting or splitting. So the process of sprouting and splitting is highlighted quite nicely in this YouTube video. But just to summarize here, the process of sprouting within the context of angiogenesis arises from the response of endothelial cells to a gradient of growth factors. And the main growth factor that is important in this function is this vascular endothelial growth factor, also known as VEGF. And VEGF will be released by different types of immune cells, so epithelial cells, macrophages, fibroblasts. And the production of this growth factor will basically result in a gradient. And ultimately what will happen is the endothelial cells will move towards that gradient. And as they move towards that gradient, they'll eventually encounter one another and form a new blood vessel, basically sprouting from an existing blood vessel. On the other hand, you have the splitting mechanism of angiogenesis. And this, again, as you could probably tell from the name, is basically the process of splitting of an existing blood vessel. So if there is no gradient formed within this VEGF production, what will happen is the vasculature, the blood vessel or the capillary will basically enlarge and then will eventually be split into 2 blood vessels. So what you need to be aware of in this case is that during the process of healing and repair, angiogenesis can arise from 2 mechanisms, either sprouting or splitting of existing blood vessels. So just to go into a bit more detail on growth factors. So growth factors play really important roles in this process of healing and repair. Generally speaking, they promote or inhibit cell growth and differentiation. They have a function or they can drive a function by binding to receptors on cell surfaces of different immune cells or endothelial cells, for example. And within health, there's a specific balance within the production of growth factors. So there's homeostasis present within a given tissue for the amount of growth factors that are being produced. If you have alteration of this balance, then you can have dysregulated cell proliferation or survival of abnormal cells. So it's really important that the immune system keeps this or the production of growth factors in a certain balance. On the right-hand side here, what you can see is there's different types of growth factors. I've highlighted some of the more important ones. You have epidermal growth factors, transforming growth factors, and also fibroblast growth factors. And basically, these growth factors have multiple functions. So they can promote cell survival, and they can also have an important role in differentiation of immune cells and also the process of angiogenesis. And this is just a figure just to highlight the many different functions that growth factors have. You don't need to be aware of the specific functions, so you don't need to be aware of what each individual growth factor does. You just need to be aware of kind of overarching roles or functions that growth factors have within the immune system and specifically within the process of healing and repair. So as I've said, growth factors basically have their function via the binding of receptors on target cells. So in a very similar manner to the way that cytokines and chemokines have specific receptors, growth factors are no different. So you have a growth factor receptor on a given target cell, such as an endothelial cell, for example, or any different type of immune cell. And basically what happens is the growth factor will bind to the receptor. You'll get an intracellular signaling cascade that leads to protein synthesis. So transcription and translation of an effector protein that is important within cell growth. So moving on from the growth factors, and we'll revisit this, we'll revisit growth factors in the next slide. I just want to briefly talk about the process of fibrosis. So fibrosis is ultimately a term used to describe the extensive deposition of collagen and formation of excess fibrous connective tissue. So this process, as you can probably tell from the name again, is driven mostly by fibroblasts, but macrophages have an important role in controlling this fibroblast function. Again, revisiting what we've talked about in previous lectures, where macrophages can be M1 or M2 subtypes, and very much dependent on whether the macrophage is an M1 or M2 subtype will actually dictate how they control fibroblast function. And ultimately speaking, fibrosis is a characteristic of substantial or repeated damage. And obviously a good example of this would be a chronic inflammatory disease. So as I've said, macrophages play an important role in this process, and they're essential in just healing and repair in general. So these M2 macrophages, which you should know by now, are generally speaking known as your anti-inflammatory macrophages. Not only do they produce anti-inflammatory cytokines, such as interleukin-8, but they also produce growth factors. So not only do they suppress the immune system and try and dampen down an inflammatory response, they also drive tissue repair. And these are 4 good examples of growth factors that are produced by macrophages and M2 macrophages. So you have TGF beta, PDGF, VEGF, and EGF. And these are also listed here on the right-hand side. The 2 that we're most interested in the context of fibrosis is this TGF, so this transforming growth factor, and this platelet-derived growth factor. And we're interested in these specifically because these growth factors can drive and stimulate functions of fibroblasts. So they can stimulate fibroblast proliferation, drive collagen synthesis. They also played a role in controlling epithelial cell regeneration, and they can also provide a chemotactic sort of response for fibroblasts and smooth muscle cells to move towards the site of infection where they are required to repair the tissue. So we've talked about the proliferation stage of healing. What about the final stage? Well, the final stage is ultimately the remodeling stage, the maturation phase, as it is sometimes known. And this is basically where the granulation tissue will be remodeled by the remaining cells. In certain cases, you'll have cross-linking of collagen fibers. If the tissue is undergoing regeneration, then you will get the formation of new epithelium. Generally speaking, what happens in this stage is that you regain your tensile strength of a given tissue up to 80% of the pre-injury strength. So basically, your tissue is again is functional and it is strong, at least to at least to up to 80% of what it was before the injury or the infection. The fibrous tissue remains, specifically when you're talking about repair as opposed to regeneration. If you have regeneration of the tissue, then generally speaking, the fibrous tissue isn't visible. And the take-home message really is that the maturation phase is ultimately when the tissue gets remodeled. So I just want to introduce you to this term, or these terms of primary and secondary intentions. And this is basically just a fancy way of saying whether the tissue will undergo regeneration or whether the tissue will have to undergo regeneration and then repair of the tissue. And this is very much dependent on the extent of the damage. So in the primary intention during regeneration, basically what happens is you have the coagulation and the inflammation phase, so formation of the blood clot, and innate immune cells will basically try and fight the infection or remove any damaged cells within the tissue. You'll get the formation of the granulation tissue, formation of new capillaries via this process of angiogenesis, and you will have some deposition of the collagen within the extracellular matrix underlying the tissue. If you have healing by second intention, then generally speaking, this is when the tissue needs to undergo regeneration and then eventually repair of the tissue. And this is because the damage is quite excessive. So you have a longer repair and healing time. You have a greater chance of scarring and also an increased chance of infection. But basically, the take-home message is the process is very similar, whether it be regeneration or repair. But in repair, you get excessive amounts of granulation tissue and then excessive amounts of collagen deposition in the extracellular matrix, basically excessive scarring of the tissue when you undergo the process of secondary intentions. So we've talked about soft tissue healing. What I'm going to just touch upon in the next 4 or 5 slides is hard tissue healing. As I've said earlier on, hopefully you'll learn a lot more about this in other parts of the course by people who are probably a lot more qualified than me to talk about it. I just want to introduce to you the idea that a similar process arises within hard tissue as within soft tissue when you are talking about healing and repair. So when we're talking about healing and repair of hard tissues, and specifically if we use fractures as an example, what happens is you have 3 stages. You have the inflammatory stage, very similar to the healing of soft tissue. You have the repairing stage. I think this can be split into 2. And then you have the remodeling phase. Okay, and this YouTube video quite nicely shows a schematic of how a bone basically heals itself. So the inflammatory stage is characterized by this formation of a hematoma, which is basically just a fancy name for a blood clot within the tissue or within the bone at the fracture. This can occur within a few days. You have, like most infections or most inflammatory diseases, you have an acute inflammatory response, which is driven by innate immune cells that basically infiltrate the tissue and scavenge any debris and dying tissue and removes it from circulation. The bone cells that are within the hematoma will be deprived of oxygen. The blood supply will die off, and thereby you need immune cells to basically scavenge these dying bone cells and prevent them from entering circulation or remove them from circulation. The repairing stage is what happens next. So this is going to occur within a few weeks. You have capillaries forming within the hematoma. Fibroblast will have a function in producing collagen fibers. You also have a role for osteoblasts and osteoclasts, basically working together to degrade existing bone or any damaged bone and then form new spongy bone. Granulation tissue arises or forms in a similar manner to the soft tissue healing, and the granulation tissue eventually becomes this soft callus bone. The second part of the repairing stage involves osteoblasts and osteoclasts again, but also chondrocytes as well. So chondrocytes are important in remodeling and restructuring the cartilage. The remaining granulation tissue from the first stage is what is known as ossified, so basically turned to bone. And this bone was known as woven bone or hard bone callus. And this can occur from weeks to months, depending on the bone that has been fractured. And then finally, we have the remodeling phase. And again, there's a role for osteoclasts and osteoblasts. So this idea of resorption versus deposition of new bone. The bone, the woven bone or the hard bone callus, hard callus bone, sorry, is replaced by what is known as cortical bone. This can take between months and years. Certain bones will never fully repair. An important role in this stage is for the process of angiogenesis, basically the formation of new blood vessels within the bone. So this was quite a brief lecture talking about regeneration and repair. What you need to be aware of is that the processes are very similar, whether you're talking about soft or hard tissues. The level of regeneration is very much dependent on the site of injury, the cells of the tissue. So you should be aware that there's 3 different types of cells and the extent of the damage. So whether it be an acute or chronic inflammatory disease. So generally speaking, an acute inflammatory disease, what arises is this primary intention where you get regeneration of the tissue. For a chronic inflammatory disease, you get the secondary intention of healing, which is ultimately where you get regeneration and then repair of the tissue. And this is where you can actually see the formation of a scar from the chronic inflammatory disease. There's 4 stages of healing: clotting, inflammation, proliferation, and maturation phases. Granulation tissue is something that we've touched upon today. Try not to mistake it for the granulomas that we talked about in the last session. But basically, granulation tissue will arise during the process of healing of any tissue. Angiogenesis is something we've talked about before, and you need to be aware that it's an important process within the mechanism of healing. VEGF and other growth factors are really important within this process. Fibrosis will occur during the repairing of tissues, e.g. chronic inflammation. So chronic inflammatory diseases are associated with the formation of scars, and the process of fibrosis basically drives the formation of these scars, so the deposition of collagen within extracellular matrix. And then finally, we've talked very, very briefly on the healing of fractures, so the healing of hard tissues. But there's very similar processes. You get coagulation, and this formation of a hematoma. You have an important role for inflammatory cells within this stage. The repairing stage is very similar to the soft tissue repair. And then finally, the remodeling stage ultimately results in the formation of new bone. Okay, so that brings us to an end of the 9th session in my series of lectures. As always, if anyone has any questions or queries or concerns about the content for today's lecture, please don't hesitate to get in touch with me. And I will see you next time for the final session, which will be on hypersensitivity and ultimately allergic reactions that you may or may not encounter within the clinical environment. So thank you for your attention, and I will see you next time.